So today I'm going to be demonstrating how to insert an indwelling Foley into a male patient. So I have already verified my orders, performed hand hygiene, looked at my labs. I've came into the room. I've introduced myself to the patient. I've identified the patient with two identifiers. Let's see, I've already gathered my supplies, and I'm here at the bedside, and I'm going to go ahead and start the process. And here we go. My patient is already in position for me, and first thing we're going to do to start this process is put on a pair of clean gloves. And the first thing we're going to do is provide some pericare to the area with soap and water, just to make sure everything is clean before we start the actual procedure. So my patient is already laying supine, legs are slightly extended but abducted, and we are going to go ahead, and I've placed a clean chuck underneath the patient while I'm doing this, and I'm going to go ahead and clean the area with soap and water and then rinse and dry it. So I'm going to start at the meatus of the penis, washing it, finding a clean spot on my rag to make sure that I get everything clean. Get a dry one so I can wet it and rinse it. Starting at the meatus again. Alright. And I am now going to dry that with a dry one. I'm just going to pat dry so I don't rough anything up. And this patient is uncircumcised, so I did pull the foreskin back to clean. And now we are going to move on to the next step. Discard my gloves. I'm going to perform hand hygiene one more time. And I'm back at the patient's bedside. And I'm going to go ahead and place the catheter kit in the middle of his legs, but closer to the knees and ankles. That way I have a little bit of working room, but I like everything to be here in the middle with me. That way I'm not breaking sterile field. So I'm only touching the outside edges, making sure that they lay flat. Make sure you have a good camera view there. And then I am going to drape the patient to where only the genitals are exposed. And then I'm going to put on my sterile gloves. Keeping everything sterile as possible. So I'm going to just grab by the cuff, slide my hand in, only still touching the cuff. Now I can freely touch this glove, but making sure that I do not touch my skin at all. I'm going underneath the cuff here to help. So I'm here, the patient is draped, and now I can start my process. And first thing I like to do is take these off, and I'm going to just set it up against my box. I am going to open my petroleum jelly. I'm going to squeeze it into my tray and insert my Foley into that jelly and just keep it there. I'm also going to take the syringe of fluid and I'm just going to attach it to the catheter to where when it's time and my Foley is in place, I can inflate the balloon so it stays in place. And then I'm also going to go ahead and attach the tubing to the bag to the Foley, and everything is still inside my box and it's still sterile, so I haven't broken any sterile fields here. So at this time I'm going to make sure that with my non-dominant hand I have a hold of the penis near the meatus, and I'm going to take one swab out of my kit and I'm going to go to the furthest end away from me, swipe on the, which would be the left side, just once, toss it, grab another stick, go to the closest part of me, swab once, throw that away, grab the last stick and go straight down the middle and toss that. Now with my catheter lubed, I can forward the Foley tube through. Now I am in place. I see fluid coming out, so I'm going to go ahead and inflate the balloon on the Foley to about 5-6 cc's, and I'm going to pull back just a little bit to make sure that we are in place. And then I would have a stat lock, and I'm going to make sure that I adhere it to the patient's leg. That way it helps with the cut down on friction and causing infection because of the catheter not going in and out as much. And I'm going to take the drainage bag and we are just going to hang that off the side of the bed on a part that does not move on the bed. That way we do not pull the Foley out. And at this point, I would get a sample out of the bag if needed for any type of labs, if we need to run a UA or CNS, and I would clean the patient up, make sure that I put the foreskin back where it belongs, that way we do not cause any damage to the penis, and clean up my mess, wipe the patient down, put him back in a comfortable position, make sure that if he wants proper dressing on the bottom, we reclothe him and everything to his comfort level. And I'm going to document the color, the clarity, the amount in my patient's chart regarding the procedure, and that he tolerated it well with no complaints. And at this point I am done.